Good evening and good to have you with us in the 9 p.m. edition of the Urban Debate, and it's a very special episode this Friday night. Viewers, as you all know, we have launched a campaign to spread about awareness about mental health, to ask people to be a little bit more aware, to let go of their inhibitions and talk more, to share more, to open up, to be sensitive about people around them, to act now. That is our campaign. We believe that as much as our physical health is important to us, so is our mental well-being. In our daily lives, we often don't take care of that aspect. We often don't even think about it, don't even share, barely ever speak about giving it the right care. But it is required. It is required especially more in times like these, in times of a pandemic, in times of a recession, in times where we are all of us are learning to live a new lifestyle ever since the COVID outbreak. We're all working from homes. We're all maintaining our distances. It's difficult to meet your loved ones. You have to maintain your distance, maintain your hygiene. You barely get out of home. You're in your house, surrounded with the same set of people day in, day out, but you still got to work. You still got to take care of your health. There is a lot. And then there is the economic crisis, the economic burden, the financial uncertainty that many are facing. So week after week here on Mirror Now, on the Urban Debate, we are going to pick up different aspects about mental health, about depression, about all kinds of anxiety, because we want this conversation to be held in every household and in every company, in every office of this country. Tonight, that's our focus. The work environment for all of us. It plays a huge role. We spend a lot more time perhaps in our office or doing our work with our colleagues than with anybody else. As per a survey conducted by LinkedIn, the LinkedIn Workforce Confidence Index, where about 16,199 professionals were surveyed between the month of April to September, 2 in 5 people had experienced increased stress or anxiety. 2 in 5 people had experienced a higher level of stress or anxiety. 60% felt lonely at some point while working remotely. 37% felt lonely. 41% said working remotely is slowing down their career progression. That's a significant concern people seem to have. When you are not in office, when you're not close to your boss, to your colleagues, it's not working out right for you. 36% felt remotely working was harming their work-life balance. And I'm sure a lot of you will actually connect with this. I would think there are more who would feel that this is harming their work-life balance. There are no timings for most people in most sectors. Because it's a work-from-home call, it can happen at any given point, not just within your office hours. 23% said that they were given well-being initiatives in the early months of lockdown from their company. 42% think their companies would stop giving them leaves after pandemic. Are our companies, is your company, your employer doing enough to take care of your mental well-being? Have they taken any specific measures to handle your stress and anxiety, especially during times of a pandemic? I'll give you some examples, and maybe some of this has happened in your company. Dedicated networks and peer groups are being set up by certain companies. Special departments, in fact, are being set up. Experts are being called in and hired by companies to guide the staff on emotional well-being. And this is actually a lot to do with the senior managers. They need to be sensitized first, only then can they take care of their employees. A dedicated helpline, many companies have started this, a dedicated helpline for the staff to reach out to for any kind of help that they need. Peer-based counseling services as well, and an employee assistance program that is now very common. But is this enough? Is it even functional? Does it help? Or is it all on paper? Now, that's the big question I will ask our panelists this evening as well. Are these steps only on paper? Do people still feel comfortable enough to use any of these facilities to come up and say, hey, I have a problem and I would like to talk about it without any fear of repercussions? Suresh Kumar, Executive President and CHRO of Polycab India, joins us this evening. Dr. Shwetambra Sabharwal, a psychologist and psychotherapist, joins us this evening. Tushar Pradhan, Chief Investment Officer at HSBC Asset Management, with us this evening. Dr. Santosh Chaturvedi, Senior Professor of Psychiatry at the National Institute of Mental Health and Neurosciences, or NIMHANS as it is known as. Richa Singh, founder and CEO of Your Dost, joins us as well. Great to have all of you with us this evening. Let me actually start with Tushar Pradhan. Tushar Pradhan, tough times, economy-wise, lifestyle-wise. How is it that, the top companies of our country are taking care of their employees?
Yeah, I think this is a very crucial period for everyone. And especially within HSBC, I can assure you that being a global company, this is not only an India issue, but it is actually a global concern across each of the parts of the bank. HSBC has actually come out with a very large framework on mental health, and it has a tremendous understanding of what everyone is going through to this period. And I must say that my own personal experience here has been about how we all can reach out and help each other without even waiting for an organization actually to work that for us. It really depends on each of us to come out and express ourselves. And for that, we need a little bit of personal freedom to be able to do that. And any part of a spiritual practice or something which helps us to gain that confidence and courage, these days I find is very, very crucial to be able to do that. Especially as you mentioned in our field of stock markets and situations where are anyway outside of our control. Many times I feel that periods of crisis really bring the best out of people. So I'm quite helpful. I'm hopeful that these things, these initiatives actually will become more mainstream as we go along.
Okay, let's in fact ask an expert right now, and I want to start off with Richa Singh. Richa Singh, what are the kind of options that companies in corporate India can look at? It's one thing to say, okay, we are here for you. Yes, let's talk about it. But how do you ensure that people feel safe to do that?
Right. Thank you for that question. Right. In a country where we have grown up saying seeking support is probably a sign of weakness. It's not a sign of courage. It takes a lot for someone to come out and talk about it. Right. I think the second step is what are things that we provide, but can we provide that safe space? Right. I think all of us, or I think at some point or the other, would have seen repercussions of being vulnerable, talking about things where either they have been bullied, where they have been they face repercussions, right? So can we create an environment where they feel that their career growth, their perception other people have about them will not be impacted? I think that is extremely important because that is the way we have grown, right? Where we have always heard that probably seeking support is not right. It is a sign of weakness. It's not a sign of strength. Hence, we need our seniors, the top management, to say that, it's okay. We all go through it. We all have our good days and bad days, and it's okay to seek support, right? And then having those providing support to people at an individual level. Can there be trainings at teams level? Can there be norms at an organization level that the organization could look at, right? From providing EAP services to a lot of training for the managers, to a lot of training for senior managers, to a lot of activities which foster emotional well-being. Can some of those things be looked at?
Okay, let's take it point by point then, and I want to just, go across to Dr. Santosh Chaturvedi. Dr. Santosh Chaturvedi, to what extent does your work environment, play a role in terms of causing stress or anxiety? What percentage of people actually find that as their biggest cause?
Thank you, Tanvi. Before that, you mentioned some figures, okay? And since NIMHANS is also a research institute, I'm just comparing. I mean, it never occurred to me that what is the prevalence that the LinkedIn study found. And they found 40%, 2 out of 5 had stress and anxiety. We did a study with the major ITES sector, I don't want to name them, about 10 years back, and the prevalence was same. 38% of people at that time had on an interview actually, so it is much more higher because LinkedIn must have done a survey through online methods. So it has not changed. I'm more surprised at the 40% of people who did not feel lonely. Because I haven't met anyone who did not feel lonely. I think there is some amazing amount of resilience in our people. Okay, so now another thing I would like to say, you had mentioned in your introductory remarks about stigma and stigma towards mental health. One good thing which has happened because of the pandemic for mental health professionals is that the stigma towards mental health has become less. If you see, the larger picture that you have been seeing, two main health issues have preoccupied the society and the government of India. One is the virus and the vaccine, and second is mental health. And the amount of attention which has been given to mental health, I happen to be the chair of the task force for Government of India, Ministry of Health, to look after the mental health. And we have done numerous changes, things which were not possible earlier. It has come as a blessing in disguise. Suddenly, the stigma towards mental health has come down. See, so many people in your survey have been talking about anxiety, loneliness, work-life balance. Well, the main issue which you asked me just now is that, see, the whole pandemic came very suddenly. And everyone was taken, with unprecedented anxiety. Nobody had any clue. Not that we have much clue now, but at least things are better. So things have settled down now, and people have realized that this is what is going to happen, and this is going to stay. Certain of the things are going to stay. Mask is going to stay. Now vaccines will become a regular habit. Distancing would be appreciable, if it is possible. I know a lot of people come and say not only they miss meeting people. I haven't shook hands with anyone 9 months. Forget a hug, and I haven't seen a person smile other than on the video cam. So lots of things are there. But I also see in the last few weeks and months, a trend is coming up that people there is no other choice. They have accepted it. They have come to that stage of acceptance. And work-life balance, as you were asking, needs to be maintained. People, the issue is now home is school also, home is gym also, home is yoga center also, and home is workplace also. In all this, the home is lost. There is no home left. So on one hand is your work table, other hand is the kitchen, third hand is for you to do exercise. Okay, for middle class people who have 2 bedroom, 3 bedroom, it's all right. What about people who have a single room house? It's so very difficult. But
in fact, Dr. Chaturvedi, you're saying that home is your gym and your workplace and your detox place as well. But the biggest complaint I've heard from a lot of people is that all parts of your home is your workplace now. Your dining table is your workplace. Right. Your living room is your workplace. Your bedroom has become your workplace because the boundaries have become so blurred in many sectors that it's becoming difficult. And I feel this is a lot to do with the awareness and the sensitivity of your reporting managers. They have to ensure that they bring in a system where you are able to draw the line and understand.
So there is no home. From work we used to come to home. From home we used to go to work. Now there is no home.
Correct.
So that's
correct. I just also want to bring out another interesting point because you raised, how people have responded to this LinkedIn survey. It could also sometimes be about the platform. For example, we initiated a live poll today on various platforms from Twitter and Instagram, and we asked people, would you consider having an honest conversation about your mental health issues with your manager or co-worker? On Instagram, 70% said no, we fear judgment. So we wouldn't. Only 30% said, yes, we will be comfortable. We'll also show to our viewers what happened when the same question was asked on Twitter, where a larger percentage said, okay, we are comfortable, 44% said, but still more than a majority said, no, we fear judgment, we probably won't talk. Interestingly, and I don't know what the latest data is, but the last time I checked for LinkedIn, 73% said they will be comfortable. It's the opposite. Now, this could happen because unlike Instagram and Twitter, you're not anonymous when you're punching in your response. So when there is a fear that, your professional network will know what your response is going to be, maybe, I don't know, maybe that's one of the reasons why it's so different. Dr. Shvetambra, this could also be a reflection of how people are not comfortable opening up on a professional networking site. Only 27% say they fear judgment.
Thank you, Tanvi. That is a very positive statistic that you have presented. However, I'm a soldier on the field, so I'm going to give you my experiences, having worked now for 17 years. That experience vis-a-vis the last 1 year of experience. So what I'd like to say is that, yes, there is a lot of positive outcome in terms of companies reaching out, providing workshops and groups for conversations. What is happening is that execution is not as rigorous. As far as stigma is concerned, even today, if I ask someone to fill a form for history, they will skip the detail of company name and office number, and we don't insist on it, but it does signify their fear, of stigmatization, marginalization, even jeopardy in terms of growth. So people are not comfortable to let us know where they are actually working. On the positive side, we've been approached by several corporates to have workshops, to be available in terms of, crisis management, firefighting for mental health concerns. This comes down to two things, according to me. One, like you rightly pointed out, the attitude of the senior management and leadership. And I think that makes a very big difference. The collective personality of the leaders in a company, and I've seen it firsthand, can make a very big difference in terms of supporting their teams, whether it was before the pandemic or now virtually. And the second thing is, company strategy, company culture. How open is the culture in terms of people talking about their issues, and what is the consequence of it? Even if you give me positive statistics where people are saying now they're open to talking about, their problems with their managers, what is the outcome of it? What are the policies that are in play that will safeguard their growth, their promotions, and their jobs? Why people are also willing to talk today about their concerns is because we have been pushed to the brim of insanity. The amount of fear and anxiety that people have experienced because of the pandemic, exacerbated, rightly so, exacerbated by mandatory precautionary measures, social isolation, huge one, children at home, another one, worried about online education, another one, working out of home, where like Dr. Chaturvedi rightly pointed out, there is no home. You're assuming you're at home, you're assuming you're at work, you're switching on, switching off within seconds. Stress levels are over the roof. So now people are willing to talk to their managers because they are their touch point. But I must say that the stigma is still there. The fear is still there. So this could actually just be a desperate measure. What it requires is for senior management, for leaders to discuss what needs to be done with that data. Identification is extremely important. Vigilance, surveillance, management and follow-up of concerns. Because what do you do with, let's say, someone who is consistently absent? Is there someone in your team who can identify why this person is absent, why this person is seeming low, dysthymic. So those are the things that are really, really important to incorporate in these policies, because what do you do with that conversation? Are you equipped to deal with that conversation? If you're outsourcing, is that data going to be protected? So there's a ton of rigorous work that is still required. And I feel that it really needs active governance, in terms of legislation, because we really lack that. I think mental health policies have been under prioritized severely, even though we do have a National Mental Health Act, and we do have every now and then we have certain amendments, but they are very reactive in approach. They are not proactive. We're looking at health as absence of disease, which is a very big flaw. We're looking at curative policies. We need to look at preventive policies. We need to have policies which will help us prevent mental health concerns. I mean, India is sitting at the top rank of with suicide rates, being such a young country, highest number of suicides between age 15 and 29. And isn't that as scary as going through a pandemic together?
Yeah, absolutely. In fact, the point that you raise, if I may just, Dr. Shwetamra, take it to Mr. Suresh Kumar. Mr. Suresh Kumar, there are two aspects. One is, of course, preventive, and the other is responsive to when you find out if somebody is in trouble. And a legitimate point that Dr. Shwetamra raised, if somebody is repeatedly, absent and missing work days, how does the reporting manager respond to that? Are our seniors trained to handle such situations?
See, I wanted to answer this in a different perspective. Let us understand first and foremost the mental illness. Mental illness is not a disease or a sickness. And that is what we need to acknowledge. And it has to be looked into two ways. First is it affects us inwardly and as well as outwardly. When I speak of inwardly, when we feel that we are in a stress or we have got certain amount of depression, are we ready to acknowledge that? Once if we acknowledge it, then only we can find a remedy for it. Second, when I speak it of outwardly acceptance, that I mean to say is that your company, your leadership, your senior team, whether they are allowing you, giving you a space to speak it out, to mend out your stresses, so that you create an open environment for the people to speak freely and come out freely. Now, when you speak of absenteeism or when you speak of people not coming and attending the companies, I had many friends in the fraternity, even my own organization. We usually acknowledge that in case if the person is not able to come and attend the offices, we don't put any pressure on him. We say, okay, you are not keeping well, you are under certain amount of stress. Please go, take your leave, be at home, and whatever best you can do sitting at home, do that. And many companies are doing it. And one more thing which I wanted to admit over here is this pandemic has taught us many good things. Now we can face these challenges more easily in future. We never thought that there will be a time when we will be working from home. We never thought that we keeping ourselves at a distant space, we still be maintaining relationship with our families, with our employees, with our colleagues.
Right.
So these are certain, so we need to work on possibilities. Now the days of expectations have gone. Now what is expected out of me is not more important, but what is possible for me is more than important, because the future is very uncertain. So in this uncertain future, we need to find our own space and we have to be there within. So, and if that is going to be the reality, then let us face the reality. Why we should run away from the reality then?
No, I completely agree with you. It is time to act, not run away from the realities. But Mr. Tushar Pradhan, on the point of preventive, or of setting up an environment that's actually helpful and doesn't add to the problems or aggravate somebody's anxiety or stress, how do you tackle that in a highly competitive financial segment, for example? It's all about Excel sheets, it's all about your productivity, these are your targets, you need to meet these targets, that's how your performance is going to be judged. How do you ensure that that doesn't convert into anxiety and stress, which could be damaging?
Yeah, it's a very important question you raised, Tanvi, because no matter how much support you get from the company, no matter how much support you may even get from your own family, ultimately it relies on the individual. The individual has to find the reserve within himself or herself to be able to deal with the situation. How much can someone explain or maybe try to support you from the outside? At the end of the day, it is you as an individual who will have to come through. And what are the things that we do to ensure that we prepare ourselves to do that? And there are these practices, at least in my own personal experience, of having meditated under the heartfulness meditation technique, or it could be any other meditation technique, which eventually makes you understand that you are an individual, you are a part of the society, you are a part of what is happening around you, and you have to understand that you have to act on your own and on the basis of what you understand you to be. So I think unless we spend some time on understanding our own psyche as such, our understanding of how and what triggers us, and it could be a pandemic, it could be any of the other circumstances that we face in life. But I believe that as a personal practice, if one selects some sort of contemplative practice, some sort of coming back to yourself, and introspection, I think it goes a long way to deal with any of these problems that we talk about. And eventually, it will make us much more balanced to be able to deal with not only what we have to do from a work perspective, but as a healthy individual, as a part of society, as a part of family, and of all what we need to do. So I strongly recommend that, as a way to come out of this problem.
Okay, point well noted. We've also got lots of viewers calling us in today. Apart from the live poll, we've opened up our phone lines. We have, two experts also with us, three experts in fact, who can respond to if our viewers have any specific query. But on the phone line with us right now is Anand. He's calling us from Delhi. Good evening. Go ahead, please.
Good evening, ma'am.
Yes, Mr. Anand, what would you like to say?
There's a very good initiative. Act Now is a very good initiative because this mental illness or being alone has not been discussed in a big way across the platform. Now we have got a platform where people can analyze that there's some other illness or disease. I differ with Mr. Suresh Kumar. He said that it's not a disease. Actually, it's a disease. Mental illness is also a disease. We need to address it properly in time so that the person comes out of it. Now, with this pandemic, already the person would have been in stress. With this pandemic coming into the scenario, he has gone into more depression. More depression means it leads to two logical solutions. One is coming out of it, or next is taking extreme steps. Because in India, we have a culture of rat race. Let's accept it. Let's progress from there. Because everybody wants to be number one. Nobody can be only number one.
Yeah.
There are number one, number two, number three, number four, number five. In a corporate situation, people always think, I need to be the best. I need to be the best. Being that and your immediate manager, you also said that being the best, your reporting manager has to take care. Reporting manager itself has this problem.
Yes.
Where the subordinate goes. So
Absolutely.
It's a corporate decision which makes all the differences.
Okay. Absolutely, Mr. Anand. Thank you so much for calling and sharing your views, and I'm glad that you're participating in this initiative of ours. And I would urge you to even speak to people around you and make them also a bit more comfortable in talking about what they may be going through. Now, I have a specific question, for our experts, and Richa, I'm going to come to you first. In your experience, especially in the year gone by, what has been one of the biggest issues that in any company, any employee faces or raises, and your solution to that? What do you tell the company or that employee?
Right. So right now, Tanvi, I think one of the biggest thing that people are reaching out for support. So at Yodos, we work with 100 plus organizations, right? And one of the biggest things people are reaching out for support is the poor work-life balance, right? my day doesn't end. I do not know how to put a stop on things, and because of that, I'm feeling overwhelmed. And again, there are different kinds of people. There might be people who are living on their own. They feel very worried. They are bachelors who are 21-year-old, 22-year-old, stuck in a different city, feeling very overwhelmed. How are their parents doing? How are things back home? And feeling very overwhelmed because of that. There's another category of people reaching out for support who might be both are working parents. Like I think doctor was mentioning to us how the home has become from a yoga center to a school to a office. I think that's also something that group is facing a lot of challenges where parenting at home has become such a difficulty right now, right? Because there's less help. There is they have to manage home and children at home and the work. And the third is people facing a lot of difficulty with blurring of the boundaries. I think those are the three major things that we are seeing people reaching out for support at this point in time.
So let's take blurring of boundaries as an example. Now, for you to fix that, you will have to find, the courage to stand up to your boss and say, no, this is now out of bounds. I'm done. I'm not going to be responding to your calls or emails or, whatever platform you're using for conversation anymore. Now, how does one employee do that if you fear repercussions or prejudice of any kind?
Tanvi, if I could just add, I think it's very, very important for our leaders to be trained to be more empathetic right now, especially the situation like this calls for people to be empathetic to understand individuals' context, right? The way I might be at home, when I came to office, we were all at the same level, which might not be the case right now, right? Somebody in my family might be contracted with COVID, somebody so it's very important to know individuals' context right now and have that deeper conversation rather than just a how are you doing and I'm fine and stop at that, right? And then modify our conversations accordingly. I think that becomes very important so that people open up, talk to you, and then you can come to a solution.
Okay, point well taken. Let me bring in another viewer who's on the phone line. Amarjeet's on the phone line from Noida. Good evening, Amarjeet. What would you like to say?
Hi, good evening. Am I audible?
Yes, you are. Go ahead, please.
Hi, Tanvi. I'm so glad that, first of all, you kind of doing this important talk. It's the need of the hour today. And I am personally a panic attack patient, and I have tremendous anxiety issues. Although it's difficult to share such kind of information. But yeah, looking at the show, I got some courage and I wanted to share this. And, just to share with the panelists, I would want to inform that there is this huge gap in the corporate sector, in the work culture, especially in India. And this gap does not seem to fill at any way, any cost. Why? Because people treat mental illness as a taboo. When you work, mental illness is treated as a disease. Although I agree to the gentleman who said that it is not a disease, it is a condition.
Yeah.
But when it comes to these companies, I have been a patient of mental illness for the past 5 to 6 years. And at every job, I have to hide this condition. For the past 2 years now, I'm looking for a job. And when people ask me what was the reason, I never tell them. Why? Because wherever I have told that, yes, I'm a panic attack patient, I've been clearly told, you need to work on your health. You need to take a break. And, you need to get back. So things of those sorts of people are not at all open. Companies, these big companies have big HR policies and, employee relations and employee, activities, but then they don't focus on these things. For them, they want employees to be 100%. Mental illness is treated like it's a big disease, taboo. And companies, they are not open with the idea of interviewing. Forget giving jobs, forget giving opportunities or, getting them into the system. The moment you tell them that you are a patient, you are put on hold. So this is what I want to share.
Well, that is the unfortunate reality, Amarjeet. more power to you, the fact that you called us up and you were so open and willing to share with us. Thank you so much, and I hope that these conversations are able to bring about a change gradually. It won't be an overnight process, but together we all can do that. Thank you, Amarjeet, and you've raised a very pertinent point. Mr. Suresh Kumar, if I can come to you, and I was going to ask this question, the response of the companies. Now, if you heard Amarjeet, a lot of the response he got from his employers was, what you can do, you should take a break, you should get out of it. I don't know if any of them wanted to know, how did we add to your problem? Did we aggravate it? Did we not respond to you appropriately, or create an environment which made it worse for you? Now, is that a problem, a larger disconnect between companies and their staff? Just sending your employee to a counselor may not be enough.
See, I wanted to answer it differently. Now, let us first understand that our job or our profession, what we have selected, is our choice. That we need to acknowledge. So, any job which you are taking, you are going to face some amount of hardships. So it is up to you that how you will be dealing these hardships. And this is number one point, which is within us to identify those obstacles, those hardships, and find out the way within us that how we should be coming out of it. Number two is that our environment is how friendly within a corporate or in the family or within everywhere to see that we feel comfortable in speaking out. We feel comfortable in communicating with our colleagues. Now, in case if suppose the communication and as the transparency and openness is an environment in an organization, believe me, I don't feel that we can have any taboo of mental illness or any type of stress we can lead into it, because we have to make this job a joy. We have to make the work a fun, and we have to create a lot of passion in seeing that what I am doing is really I'm enjoying. And that is where the leadership, that is where the management perspective come into a play in creating an environment. I will give you a very own perspective of my own company. Now, it is not that we are not under pressure, but we should find out the ways of weeding out the pressure. So what we do is that we have got a friend circle, we discuss with them, we come out and we share and we do it. And we find that, okay, we have come out of the pressure. Even to an extent, if you see the promoters in my own company, they are very open. And we can share with them our problems, we can share with them our stress points. And they come up very openly and saying that, okay, we acknowledge it and there is a need to change. So this is where the culture of an organization plays a very, very vital role to see that how to tackle this problem. Number one. And number two, very important is that while their pressure is going to be there, let us acknowledge it the way it is going to come. So when you are under pressure, where you are working under pressure, you should always have the space to find the ways that how you will be releasing this pressure. I have found some of my colleagues in my previous companies and all, they don't open it. They go hide in the washroom and I've seen them weeping over there. No, that is not a solution. What you are doing is that you are keeping this entire stress within you. You are not opening. As a result, that leads to the diseases. The day when you have a culture where you say that I am here to share my feelings with others and I acknowledge that there is a reason to share and there are the friends who need to help me, and it is a very open and transparent thing that is prevailing in an organization, lot of things can be solved. And that environment is within us to create those environment and work on those environment.
Dr. Chaturvedi, would you like to come in here and add to this? And also, what Amarjeet was pointing out about the response of the companies. Employees not feeling comfortable to say what they're going through because they won't get the job or they'll be fired.
Yeah, I mean, it's very unfortunate. But I'll agree with that there are companies, which are, I would say, very cautious about having people with mental health problems within them, because of number of reasons, including that they have to provide, care for them. And it's also so, poorly understood. See, if a person has, let's say, ischemic heart disease or hypertension or diabetes, they are probably a much bigger risk for a company because there can be a death at office, because of hypoglycemia, hyperglycemia, any other complication, a stroke or a cardiac arrest or ischemic heart disease. So there are other conditions which are there, but those are probably people have better information, they are better understood, and as we are seeing in the discussion, these things about the mental health problems and issues are not very openly discussed, and they are not very well understood. But on the other hand, there are other types of companies who, as Mr. Suresh Kumar was saying, they have been very proactive. I'll just share one small thing. One of the companies, I don't want to name it, and they called all their employees that we want to discuss one very serious problem. And so everybody came. And what the company did was they brought a stand-up comic and said the problem is we are not having enough fun. And I know it because I have a stand-up comic at home, and my son was doing this, and it was amazing because people were taken, pleasantly surprised, and they had a couple of hours of fun. So like that, I think there are many ways by which different companies have, thought of innovative ideas of doing it. We should also understand that even if there are mental health issues, the solutions we are providing are from common sense. Okay, it has just been there, 9 months, 10 months. The last pandemic was 100 years back. We don't have much experience. The books have not written much about it. Clinicians don't have much experience about it. We are just trying our best, like dealing with the infection with whether it is chloroquine or some other medication or oxygen. We have been trying hit and try methods. So the same thing we are doing. We are trying to do our best. As some things, like yoga, meditation, help in everything, in stress related to everything. But I think as time goes by, we will have much better preventive strategies, much better curative strategies, and much better strategies of improving overall quality of life, and accepting the new way of living. I don't think it will change drastically. People have been optimistic that it will go back to what it was in 2019. I hope it happens, but I'm not so sure. So we'll have to see, wait and watch what happens. We'll take one step at a time.
I hope so too. I'm extremely hopeful and optimistic about it, but I am not so sure either, Dr. Santosh. Let me just bring in another viewer. Kalyandeep is on the phone line calling us from Bengaluru. Good evening. Go ahead, please.
Hello.
Yes, Kalyandeep. What would you like to share with us?
Maybe is the line audible?
Yes, it is.
I'm calling from Bangalore, actually. Okay, there is a Dr. Santosh, Tushar, and welcome back. Performance, Jaipur. Okay, since you.
Kalyandeep, we're going to try and patch you again because now the line is a little patchy and we are struggling to hear what you're saying. So we will get you back on the phone line. But meanwhile, let me go back to Dr. Shwetamra as well. Dr. Shwetamra, being realistic about where we are and how life functions, and it's not just specific to India, across the world. At the end of the day, your reporting manager, your senior manager has also a target to achieve and to fulfill. And he's interested only in doing that. Now, how do you break this chain? How do you make him a little bit more sensitive and understanding in terms of dealing with somebody who he thinks may not be able to give their best because they have a mental health issue?
Absolutely, Tanvi. I'm so grateful you asked me that question because it'll allow me to give you a couple of grassroots suggestions that I have. And I believe that those can make a very big difference. In small, big ways, it has come up in conversation earlier. I think it's extremely important for us to focus on a strong and supportive legislature for those who are suffering and a strong and empowering legislature for those who are helping. Whether these are companies, whether these are mental health professionals, whether these are social workers, there isn't much there isn't a one go-to strong regulatory body, that can be banked upon, reached out to, communicated with to find out what are the rights and wrongs, do's and don'ts. And I think that's extremely important because especially in the corporate sector, when issues come up, not everyone is equipped to deal with mental health concerns. And this is not just disease. I'm also talking about just being able to identify a concern in time, because typically when cases come to us, they are already chronic, prognosis is already impacted. The other thing that I want to talk about is a lot of these policies, a lot of these rules and regulations are put together not entirely by representative bodies. We have someone, there is a problem with people suffering with disabilities. There'll be an amendment that will come in a curative approach. There's someone who needs rehabilitation work, and there'll be a new amendment there. What we really need is a representative body with academicians, with active practitioners from the field to be able to put together policies for people to follow. Mental health, I mean, whether it is in the corporate sector or it is at home, it is debilitating at the same degree. So there have to be certain policies. And the most crucial point that I want to make here is, everybody's been talking about awareness and stigma and how do we get rid of it. I think that, we have to have an inclusion of wellness studies in the curriculum for children, because that's when we need to start with working on awareness and removing stigma. People who, there was a discussion about subordinate, manager, leader, etc. We all go through school. If we are more aware, somebody also spoke about, how to fight it by yourself. Trust me, when there is somebody going through depression, they're not able to get out of bed. Forget being aware of how to bring themselves or pull themselves out of that situation. So when there is awareness, wellness studies, not just about, difficulties, challenges and diseases, but also about how to keep yourself healthy, keep that bucket full of resources, right from, early interventions from childhood, also followed through in college. I think we could make a very big impact collectively in terms of mental health and how mental health concerns are handled later in life.
No, you're absolutely right there, and this has to be, since a younger time. In schools, we repeatedly talk about it. Even in schools, not too many of them still have the kind of counseling and as part of your, syllabus. At home, the environment to talk isn't there, but gradually these changes have to come in, and I think a big part of it is your work life, and it can't be, and I will emphasize on it because I strongly believe it cannot just be about asking your employees or giving them the option of a third party platform or an expert in-house expert who will listen to you and guide you. It has to be about how you train your people and sensitize them at every level. Because until unless it's a top-down approach, it's never going to work if you keep reacting and resolving the problem that your junior-most people in the team have. That's only coming about. A part of it may be personal life, but a part of it could also be what's happening in your professional life and the environment where you're spending a lot of your time. Sanjeev Rao is on the phone line. He's calling us from Pune. Good evening, Mr. Rao. Go ahead, please.
Yeah, Tanvi. Good evening. Actually, I'm a great fan of yours because always I like your subjects which are always contrarian compared to any of the other populist subjects which are being discussed in the daily news.
Thank you, Mr.
Coming back to today's subject. Okay, I would like to actually share my own experience. I was actually working with one of the U.S. multinational for 20 years. Okay, compared to going back to the management or the higher people in the organization for any of your grievances. If you take my first 15 years, around 5 years back, the things used to be very, very well managed, and we always used to go to the HR people to share with our day-to-day issues or any other issues. Okay, and those used to be addressed very well, and we used to have a lot of faith with the in-between HR people. Okay, in last 5 years, the things have actually drastically changed. Okay, if an employee goes and share his grievances, his issues, anything which may be related to his boss or any other things, so very next day, that employee, the HR people are seen going to the bosses and sharing who is the one who has actually complained. Okay, so then it will become like a the counter means it is getting personal afterwards. Okay, then the boss will call, and again it will become more harassment to the employee. And instead of getting the problem resolved, it becomes like a higher stress level the employee has to go through. Okay, because especially in this pandemic thing, I have realized that the bosses in between mid-management people are also struggling to retain their own jobs. So they will never go and address any of those things because always it is one-way traffic. Okay, those are the things.
Right.
And this is my personal experience I'm sharing.
Thank you so much, Mr. Rao, for sharing your own personal experience. You know, that really brings about a lot of substance to our conversation. It makes it real. And only then can we, you know, have real solutions and responses. And at least some people who may be watching, maybe they're part of it. They don't realize how they respond and become a part of the problem. And this could help them realize that. So thank you, Mr. Rao. Amar is on the phone line. He's calling us from Amritsar. Good evening. Go ahead, please.
Hi, ma'am. Hi, everybody on the show.
Hi, Amar. Go ahead, please.
Hi. So I have been someone who suffered with anxiety, and I got treated, and I got back to the workforce. Largely, the jobs that are currently available in the market are the ones that are available with startups, and I feel that startups are something that form the base of the economy today. So many startups are available, in the market that you take up jobs with them, and this is the place, I think, in India, all of us, new leaders, new entrepreneurs, while we call everybody agile, they call themselves agile as startups. They also need to sort of, embrace this idea of embracing people who have had mental issues or are undergoing some level of stress. That sensitization should start at the startup culture because, after countries like, the West, Israel, we are also known as a second nation that really is around, pushing startup culture and, driving the economy forward. So I think you call yourself a technology company, you call yourself whichever domain. But I think if at the startup level, this sensitization is not done, it's not going to drive young entrepreneurs that are later going to become the CEOs of various bigger organizations like Google, Apple, whatever you may say. But if that at the grassroots level is not driven, this thought is not planted right there, it's not going to make a difference.
And Amar, I feel a lot of the startups that we're looking at today are the new age companies, the new age professionals, and they should at least be the ones who lead this change. Richa, you wanted to come in here? Go ahead, please.
Yes, so we've recently started a program for startup founders. In fact, they go through a lot of upheavals, right? A day, there could be extreme happiness because you've won a big contract, or there could be something that you lost. A lot of their companies have suffered in this time of pandemic, and I think one of the biggest things that especially startup founders or startup initial team members throw out of the window is their self-care in the time of crisis, right? I mean, it's very important for us to understand. I think mental health is an investment, right? It's not a spend that you're doing, and it's not an area to optimize on, right? If your people are emotionally well, that's when they'll do well in all spheres of their life, personally and professionally, and that's what would drive the companies forward. Be it a company of 10 people, be it a company of thousands of people, right? I think that is the core, which is very, very important and critical for both, I think, startups and the larger organizations to understand. It's not just a tick in the checkbox. It's about the culture. It's about, really caring for your people and saying, hey, this is important for me.
Yes, absolutely. Now, I have one more question that I'll take to Dr. Chaturvedi. Dr. Chaturvedi, Dr. Shwetamra raised this a couple of times. Is there also a need for an overarching policy, a policy within, corporate India that addresses this and puts in a structured way of dealing with it?
Definitely, I'll fully agree with Shvetambra and what you are saying. But many companies have an employee assistance program.
Yes.
And the WHO has given its own guidelines, and which are actually quite sensible, and a lot of thought has gone into that. If most of the companies, adopt those policies, a lot can be done. And I would also agree with what Richa said just now, that it's very important to invest in mental health, because in the end it is going to be good for the company, and they will be more productive, they will be more happy, and they will be doing much more. So I'm not sure whether a separate legislation, how it is, and legislations are they have their own strengths and weaknesses, and their opinions about how to use them and not use them. But there is already there are the employee assistance programs which are there. Some of them are very good, and the WHO has provided that, and our own very vast network of companies which are there. We should also think of some novel ways of doing it, and in the end help people and improve their quality of lives and well-being.
Okay, on that note, it's been great to have all of you as part of this conversation, and I hope we have many, many more such conversations in order to bring about a change and convince people to act now, the employers and the employees, both sides. Thank you so much to our panelists for joining us on this conversation. Viewers, it's one of our biggest challenges, and it's not easy. And I know a lot of what we said today may sound idealistic. It may sound like it's not even possible to do this. It's not practical. Companies only care about their balance sheets and their P&Ls, and that's where it ends. And that's why they would want only employees who are able to do their maximum best performing work all the time. But that's where these conversations are important. That's where it is essential to know that for over a longer period of time, for a sustainable, successful business, you need a set of strong, happy employees, and you need to take care of your employees. Of course, when times are tough and times of a recession are there is downsizing and cost cutting that happens. But even there, our companies need to invest, and owners and founders need to invest more in training their senior management to know how to handle these issues. If only your employees have a healthy state of mind and mentally they're well, will they be able to give you their best and take your company to the next level? It's extremely essential not just to have a platform where your employees can reach out to a professional, a counselor, a psychologist, or a psychiatrist for help, but also that you train your own people in such a way that the environment doesn't add to the problem, but helps solve the problem. Thank you so much for joining us on this conversation.